Hi, this is Dr. Roy Kim, your favorite Dr. Kim. Next, we'll be talking about the best filler treatment areas, and I think this can be more easily categorized into common or less common areas. The most common areas, in my opinion, include the cheeks, the nasolabial fold, and the lips. The cheeks, of course, are right here, and as we get older, they're less baby-like, they're less full, they start to get flattened, and they also drop. So, how do we fix that? We can give you filler right in the cheek area, specifically in the middle of the cheek and over the zygoma, where we can give you not just more volume, we can actually reshape your cheeks, which is a very cool thing to do. Nasolabial fold is right here, also known as the parentheses lines. This is also another common area where I need to give you filler right there. And specifically as we age, the nasal piriform, the bone here starts to atrophy, gets a little thin, so we can buff that up, we can help support it. And this fold, which exists in anybody of any age, gets deeper and more noticeable as we age. So little filler there will obviously help so that you will look more youthful and rejuvenated. Finally, the jawline, the sulcus, S-U-L-C-U-S, or the non-PC term, marionette line, where you look like a puppet, becomes more noticeable over time. One of my favorite procedures is to fill this with filler and or give you a little neuromodulator, Botox or equivalent here, so that it actually reduces the frowning, makes that line a little less noticeable, and fills it up. Another common area of facial filler are the lips. So if you have thin lips or if you have aging lips, they do get thin over time, and you may genetically be born with them, or you may have noticed over the past couple of years that they are getting thinner. Filler is the best way to actually augment lips. So what I have to do is, of course, go over what you want, the best treatment plan for you. Typically, anatomically, we want to have the upper lip about 1.0 and the lower lip about 1.2, 1.3 in terms of height. In other words, the lower lip should be taller than the upper lip. Finally, there's pout. We have to go over exactly what kind of pout you want. Most patients do need one full syringe of filler. The nice thing about the filler is that if you have a little left over, if I give you 70, 80% of a syringe and you're happy with that look, what you want to think to yourself is, instead of wasting it, I can give it to you somewhere else. So most of the time I do give it in the nasolabial fold, but we can give it to the jawline and other areas of the face. It will not necessarily give you a big difference. You may see a subtle difference, but one of the great things is that we're not wasting it. Those are by far the most common areas. Sort of moderate in terms of common areas, or maybe less common, would include the eye area and jawline. So the lower eyelid area is one of my specialties because it requires a lot of intricacy, a lot of care. The lower eye fold, along with the volume, becomes more noticeable as we age. That fold becomes deeper and more noticeable. The hollowness of the lower eye also becomes more noticeable as we get older. So assuming you're the best candidate, that is a great area for you to get filler. The jawline, to get a more sculpted jawline, is really the angle of the mandible starting way back here going all the way forward. So assuming you have weight proportionate to height, or you're not overweight, you don't need liposuction of the chin, jawline filler is a great way so that you can have a more cut and enhanced jawline. A lot less common areas. These include the temporal and forehead areas. So as we age, sometimes your temporalis, this area here, actually starts to have an indentation or be hollow. That is a sign of aging because you look more old, a little too gaunt, if you will. And this can happen in anyone. And by filling in that area with filler, you actually look much more rejuvenated. The forehead is a very uncommon area, and I rarely do it. There are concerns about the blood vessels that travel here between your eyebrows. And I do think that neuromodulator or Botox of some kind is more effective here as opposed to filling up that area. So essentially, if you have really deep vertical lines, the 11 lines that are very noticeable, Botox or neuromodulator is probably the answer and probably not filler. Another less common area is actually not on the face, it's actually on the back of the hands. So as we age, our hands definitely become thinner. The bones become more noticeable and the soft tissue between each bone actually starts to become more prominent. So HA filler, hyaluronic acid, can rejuvenate that area. Another option for filler, of course, is your own fat, which is another common procedure I do to rejuvenate the back of your hands. But both are good options for you. So I hope this video helps in terms of going over the common, sort of less common, and very least common areas of filler to the face. If you think I forgot some areas, please let me know. And as always, if you have any questions or comments, please contact me. Thanks so much for watching.